Good afternoon to all of our viewers and welcome to today's edition of NMH at 1. I am your host, Priska Anyolo, and thank you so much for joining us once again. Heading right into the video news segments for today. In our first video, residents of Ondano village in Oniipa have written numerous letters to Transnamib regarding the illegal sand mining in their village. Reinhold Kamati says an illegal license to mine was granted by the Ondonga Traditional Authority.
The experience since the establishment of this illegal gravel road within the Oniipa townland, we've experienced movements of cars at night coming to stand next to our yards, and we have a problem of our goats being stolen from the kraal at night. And that's why this illegal road, it's the effect and it's the cause of it, because now cars are coming there freely, very flexible, because now it's a gravel land, it's a gravel sand. Back in the days it used to be sandy, cars cannot reach up to here in the bush, but now this illegal gravel road has made an easy accessible to those that even bring hazard concern. And this illegal gravel road goes to the illegal sand mining pit which is there, and we are members of the community. We do not accept it, and we do not want this kind of illegality within our environment and within our community, because it's a distraction, a total distraction and a massive distraction to our environment and to our nature. So we need to preserve the natural, and the law need to be adhered. This is the reason we are closing from today. We members of the public, we are closing this illegal road today and until further notice.
Kavango West Health Director Francisca Amotenya talks about the hepatitis E virus during the official opening of the 3-day workshop in Rundu, which is currently underway and aimed at strengthening cross-border collaboration for effective control of hepatitis E virus, severe acute malnutrition, and other infectious disease interventions along the common border between Namibia and Angola. Kenya Kamboe was there.
Has notified 164 total cases of the Hep E since the start of the outbreak in the year 2017, with a total of 3 deaths, and no case was reported from the Angolan nationals. I'm glad to inform you that there has been a noticeable decline in the new Hep infection from the 2,689 in 2019 to 983 cases in 2020. But a few cases continue to be reported during the current year, which is 2021. Considering that most staff have been repurposed to COVID-19 response activities since March 2020, hepatitis E response activity has consequently slowed down on both sides of Namibia and Angolan border. It is for this region that the Kavango East Regional Health Directorate, in collaboration with the World Health Organization and other development partners, is hosting a 3-day meeting between the Kavango East, Kavango West region with the Cubango province of Angola. The aim of the cross-border meeting is to strengthen cross-border collaboration and discuss strategies for effective cooperation in the control of the hepatitis E virus, severe acute malnutrition, and other infection disease interventions such as HIV, we have TB and malaria. Let us all participate in this very important meeting and contribute positively, so that at the end we'll come up with amicable recommendations which will improve the health conditions of our communities along our borders. With these few words, I wish us all a fruitful deliberations, and I trust that the outcome of this meeting will yield greater cooperation between the two countries. Once more, feel welcome, and to our visitors, enjoy your stay in our beautiful town of Rundu. I thank you. Muito obrigado.
Josephina Ndengu from Ongwediva in the Oshana region spoke to NMH at once to Yemo Haidula about the benefits of being a member of the Shack Dwellers Federation of Namibia and how it has changed her life for the better. She encourages Namibians to join the federation. She says members show commitment and use the power of teamwork to advance their quest to become homeowners. Ndengu said it is such dedication and perseverance that has made the program what it is today. She was living in a shack but is now a homeowner. SDFN members mold their own bricks to cut costs, and through its self-help process, the Federation provides capacity building to its members in areas of bricklaying and the laying of water and sewerage pipes to enable them to work on their own houses.
Josephina Ndengu from Ongwediva in the Oshana region spoke to NMH at once to Yema Haidula about the benefits of being a member of the Shack Dwellers Federation of Namibia, or the SDFN, and how it has changed her life for the better. She encourages Namibians to join the federation. She says members show commitment and use the power of teamwork to advance their quest to become homeowners. Ndengu said it is such dedication and perseverance that has made the program what it is today. She was living in a shack but is now a proud homeowner. SDFN members mold their own bricks to cut costs, and through its self-help process, the Federation provides capacity building to its members in areas of bricklaying and the laying of water and sewage pipes to enable them to work on their own houses.
Come on now. Say hey. Listen up, y'all, 'cause I've got something to say. Hey, hey. Well, you better get ready, 'cause you know I came to play. Hey, hey. I'm tired of sitting around. It's time to wake up this time. Come on. Get on up, y'all. It's time to take it to the streets. You and me.
And now we move on to our COVID-19 monitor for today. Record COVID-19 numbers were early this morning again reported for Namibia, and the third wave of infection the country is experiencing has also pushed up the number of people housed in approved quarantine facilities to a record level since March last year. By Tuesday, this number was one shy of 2,500. Over the last 7-day cycle, 2,374 people entered quarantine facilities, while 1,757 were discharged. On Monday, 699 people were quarantined, and on Tuesday, another 707. This excludes people in self-quarantine. The regions of Oshikoto, Karas, and Omaheke still has the largest quarantine populations. Hardap also saw a significant increase with 262 entries. Karas recorded 330 entries and 90 exits. In Omusati, 233 people were released from quarantine, and Oshikoto reported 593 entries and 386 exits. The change in data for the Zambezi region is largely due to the updating of information. Tuesday's data per region has not been released yet, so the changes indicated only include entries and exits up to Monday. Moving on to the front pages of our Namibian dailies. Namibian Sun reports that last month, Agriculture Minister Carla Schlepwein made a 10-page submission to his colleagues in cabinet outlining the reasons why Agri-Basdev should cease to exist, less than a decade after it was created. According to Schlepwein, Agri-Basdev is the reason why Greens. Republican reports that winter holidays have been brought forward by almost 2 months, with schools now already closing next Friday, the June 25th, and reopening a month later on July the 26th. In an effort to make up for lost time during the holidays, vacation period will be shortened in the third term. There will also be no evaluation at the end of the second term for pre-primary pupils up to grade 9. Only 2 evaluation points will appear on reports at the end of the school year. Algemeine Zeitung reports that the Namibia Medicines Regulatory Council is reiterating that ivermectin is not licensed for human use in Namibia and therefore cannot be considered for the treatment of COVID-19. Numerous Namibians are ignoring the warning, sometimes with serious consequences. The Namibian dedicated its front page to over 1,000 Namibians who have succumbed to COVID-19. It includes prominent politicians, high-ranking government officials, and medical personnel. New Era reports that as Windhoek continues to drown under a brutal surge of COVID-19 cases and record deaths, Commerce Governor Laura McLeod-Kachirua has called for the reinforcement of all public health protocols. This is to battle the pandemic, which has led to fears of a healthcare catastrophe. Sharply rising cases have seen the local authority areas of Windhoek partially locked down, schools have been temporarily closed until the 30th of June, and public gatherings limited to a maximum of 10 people. And now moving on to the inside pages of the country's dailies. Namibian Sun reports that the Oshakati Town Council last week has dismissed Joel Nakale with immediate effect over allegations of corruption and illegally selling plots to residents. Nakale, who worked as a technical assistant at the municipality, is being accused of making residents pay for land before they can get allocated plots. Republican reports that devastating bushfires, allegedly sparked by charcoal burning operations, have razed around 35,000 hectares of grassland to the ground across 7 farms south of Ocho. The first fire on the 22nd of May destroyed 10,000 hectares, while the second fire on Tuesday this week destroyed an additional 25,000 hectares. Government wants to get a grip on the third wave of COVID-19 infections with new drastic measures and significantly tightened requirements. The death toll continues to rise rapidly. Since the beginning of the pandemic, the highest number of fatalities was reported yesterday evening after 33 people succumbed to the virus. The Namibian reports that the bail hearing of intern medical doctor Dennis Noah has been postponed for 2 weeks due to illness in the family of the public prosecutor involved in the matter. Noah is accused of raping a male patient who was injured in an accident and was paralyzed at the time of the alleged rape. New Era reports that Information Executive Director Mbeuta Uwanjarakana has become the first senior government official from the affected communities to publicly oppose the $18 billion Namibian genocide settlement between Germany and Namibia. That is it for today, Namibia. Do have a lovely Tuesday and please stay safe and stay tuned for the weather as well.